morning. Uh, as indicated, I'm with Central Maine Healthcare. Uh, and a little bit about the system. Central Maine Healthcare is an integrated healthcare delivery system that serves approximately 400,000 people who live in central and western and mid-coast Maine. Um, this is a complete healthcare system that includes the Central Maine Medical Center, which is a 250 bed uh, primary and tertiary care system. Uh, we have two smaller community hospitals in Rumford and Bridgeton that serve those communities. Uh, and we also have approximately 60 various primary and specialty practices. Approximately 35 of those are located in the 17 across 17 different communities in central Maine. And our some of our specialty services include Central Maine's Heart and Vascular Institute for specialty cardiac care. We are a major regional trauma center with life flight services that enable us to move uh, patients in need of highly specialized trauma care uh, between ourselves and our affiliate at Mass General Hospital in Boston. And we also have our strategy actually these days is really to move healthcare out into the communities that we serve. Most of those 400,000 people that we see every year don't have to come to a major hospital like CMMC. Uh, so we have started to move our care systems out into the communities that we serve. And an example of that is we have a major treatment center in Topsham out on the coast. We have just opened an urgent care center in downtown in Auburn. And we expect to continue to open more and more care facilities out in the community, those 17 communities that we serve. Um, so that's a quick overview of the healthcare system. And what I want to talk about are some of the positions that we have available in 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 our facilities in Lewiston primarily. Uh, as Colleen indicated, I am responsible for what I refer to as the business side of the healthcare system, and what that what that means is all of the accounting, finance, HR, uh, support systems that really keep the wheels on the train and keep the healthcare system functioning uh, from a you know from a business and financial point of view. The the types of positions that we have available run the gamut from um, business operations roles. I have entry level positions in customer service that require customer service skills uh, and that are the face of Central Maine healthcare to the patient community. I have a number of positions in accounting and what we call revenue cycle. That's where the majority of the positions I have are located in those teams. Those positions include a senior accountant, and we have a brand new position that isn't even posted yet um, for a senior accounting program manager. Uh, this role would be responsible for establishing an audit office and developing a series of policies and processes that will ensure that we are compliant across a variety of different areas of responsibility that we have externally as well as internally. A number of the positions uh, that we have open today really require some experience in healthcare or in the insurance world. Uh, I have, for example, an IT role that will be a senior level position where we're looking for someone who is capable of, who understands what's called PACS or PACS, who will be responsible for creating a system-wide patient archive system for our imaging capabilities. Today, because the healthcare system has come together a piece at a time, we have several different archiving systems for imaging. And we're really looking for someone who really understands that technology and is capable of integrating the systems, whether it be that we go out to a single vendor and say, okay, this is how, we want one system to fit all of our various component parts, the practices, the hospitals, et cetera. Um, or we find a way, an efficient way of integrating the existing systems into one easily accessible archive. We have a number of positions in what I call insurance verification type roles. Uh, uh, and as some of you who work in the healthcare world know, hospitals' revenue cycle is very different from the general business community in the sense that we depend on third-party payers for the majority of our revenue. And to be paid by those third-party payers or insurance companies or Medicare or Medicaid, we have to have a very complete billing system. And what that really means is that we have to code each and every diagnosis and procedure. Those codes have to be proper. They have to exactly match the care that we've provided to that patient, the diagnosis that we've assigned to that patient. And those codes allow us to bill the various insurance entities, again, whether they're public or private. And so there are a number of roles in that space. We have folks that are working on the front end who are greeting, registering incoming patients, and those folks need, only a preliminary knowledge of the insurance business because they're basically responsible for ensuring that there's a means to pay for the services that we are going to provide to that individual patient. So it would be verification of their insurance coverage, uh, or working with them to work out some sort of payment plan. Uh, as a not-for-profit hospital, we have to treat everyone without regard to their ability to pay. Uh, but for those patients who have the ability to pay or who are covered by a third-party payer, uh, we need to be as efficient as possible in terms of billing those third-party payers. And it's a very complex process. It's not just a matter of sending out an invoice. It's a matter of, uh, again, having the right diagnosis and treatment codes at the front end on the units, the various units in the hospital or the various practices, and then um, we have we have to move that information out in the form required by the various insurance providers. The Another area uh, that we are looking for someone with healthcare experience in is a lead person for our clinical documentation uh, apparatus, and this is really a QA position, that quality control position that looks at uh, information such as, do we have the most up-to-date codes? A good example is that the government has changed now, I believe, 3 times the diagnosis code for COVID-19. And so this person would have to ensure that that information is properly transmitted. The person will conduct audits of our coding and billing system to ensure that we have the most up-to-date information. There are a number of other positions. I'm looking for someone, for example, today who's an would be a marketing analyst, someone who would collect data on what are on the trends in the healthcare system, not only throughout Maine but across the U.S. Uh, Looking at what uh, both uh, competing institutions and just the industry in general. What are the trends, um, and translating that data collection into cogent information that can be shared with senior management, so we know what the latest and greatest trends are in healthcare. The I'm looking for uh, what I call a data guru for our finance organization. This is a role where um, we're looking for someone to manage the the various analytical activities that take place in our accounting and finance organization. In a healthcare system, typically you have, unlike again private industry, where you might have a an enterprise integrated single system, something like uh, you know uh, like an enterprise management system that really runs across all of the functions. We have various different systems in a healthcare environment. Things like a patient uh, medical record system, and then we have various accounting systems and databases. And so this person is essentially responsible for leading a team that enables us to gather information from those different data sources and integrate them, and then be able to present those and present the meaning behind the data to so that we can inform senior management and recommend certain actions that we need to take, whether it be regarding our financial uh, spending or our investments, our billing. So this is a really critical role, and again, it's a management position, and would reside here in. Most of all of these roles reside on the campus here in Lewiston. At this point, I'd like to open it up to anyone who has questions.